Right, I'm excited for this one. Bursitis of the hip or trochanteric bursitis. What is it? Why did you get it? Signs and symptoms to look out for, and also what are the treatment options. So we're going to go through it in this video. Let's go. So, historically, people who have had pain on the side of the hip have commonly been told that they've got something called bursitis. But I really need to kind of clarify and really kind of debunk some myths and also really give some information that's a little bit more accurate regarding what people who have lateral hip pain or pain on the outside of their hip is. So we're going to take it right back. We're going to simplify this, and let's think about it this way. The bone that sticks out the side of your hip. So when you're standing upright like this, where my hand is resting now, you can feel a little bit of a bone. That is called the greater trochanter. That is just a bit of bone that sticks out. So on top of that bone is this little fluid sac called a bursa. Now a bursa, we have them all over the body. It's there as a way of reducing friction between where tendons and muscles insert onto the bone. So we've got the bone, and then just on top of that, we've got a little fluid sac called the bursa. We've got them everywhere. Now directly on top of that, inserting onto that bone are tendons, and two tendons in particular, from the gluteus medius and the gluteus minimus. Now you would have heard the old gluteus maximus, the old big butt muscle, but we're not talking about that here. We're talking about the glute med and the glute min. Now you're probably thinking, why is he talking to me about those? Well, I want to learn about bursitis, but here's the thing. Often people are diagnosed with having bursitis and it actually isn't a thing that's going on. Now historically, that's what we thought. Historically, we thought there was inflammation of the bursa, and that the treatment had to be all about anti-inflammatories and stretching and doing treatment to loosen it all up. But here's the thing here. As research has progressed, as we've understood more about lateral hip pain, as we've started to see more research coming out, what we actually understand better now is that it's very unusual for someone with lateral hip pain that is specific to this area to only, in isolation, have a bursitis. Now, what is much more common and something that we need to kind of understand is 9 times out of 10, the thing that we're dealing with is a gluteal tendinopathy or a tendonitis. And obviously the gluteals are the muscles that we just spoke about, the glute med and the glute min. Remember, they're very close proximity. We've got the bone, we've got the bursa, we've got the tendon attachment. So it's not uncommon in some cases where you have a flared up tendon that you can get a flared up bursa as well. But the primary thing that we're dealing with isn't a bursitis, it's a tendinopathy or a tendonitis. Now that doesn't take away from how bad the pain is. So let's talk about the pain, the signs, the symptoms. Now people who suffer from lateral hip pain, because of this, that we umbrella term it as greater trochanteric pain syndrome, because it could encompass a few things. Remember, like I said, greater trochanter, so greater trochanteric pain syndrome, a bit vague, but tells you that you've got pain in that area. Usually has a very distinct cohort and around a 4:1 ratio towards female patients, and often the age range is around 45 to 55 in that bracket, so give or take. And that's important to know. Important to know in regards to why it develops, because sometimes there are some risk factors that could be usual tendon risk factors for tendonitis, like sudden increase in activity, sudden increase in volume of whatever kind of job that they're doing or exercise, or even stretches, classes, something new at a higher volume that hasn't been done before, that for some reason has precipitated this injury to come about. Equally, there are other factors such as like weakness or deconditioning around some of the muscles here, causing it to do too much, or certain kind of behaviors, whether people do a lot of hip stretches, or potentially those who may be also a little bit more sedentary that don't exercise as much, may increase their risk of developing something like this. Now, equally, you could probably sit there and think, why is it that a female would have such a higher prevalence of these issues in comparison to a male population? But think about it this way. These tendons that we're dealing with are attached to this bone here, but they're obviously attached to your pelvis as well. Now, the female pelvis is different to the male pelvis for obvious reasons, meaning that the amount of load that goes into these areas for a female pelvis and tendons is usually a bit higher. Now, that's fine. People get on with that their whole lives. They don't have any problems. But when there is a tendinopathy, that might be potentially one of many risk factors contributing towards it. Now, obviously, if you've got someone who is sedentary or doesn't exercise as much, there are physiological and systemic and causes from that perspective that also might contribute to the onset of why this has developed. Now, other things that we need to really try to consider in regards to potentially the signs, the symptoms, and how it might present are a little bit more important, because the risk factors are hard to identify. The risk factors as a patient are hard to understand the relevance of. So let's talk about the signs, the symptoms, how it presents, to try and understand if this is something that you or someone you know or whoever it is that you're watching this video for might be having. Now, often the symptoms around this lateral hip on the outside are slow and gradual and progressive. They happen over a period of months and can get to a point where symptoms have become from one, quite a deep dull ache, to quite sharp, exquisite, local, real quite severe pain that sometimes actually presents similar to an arthritic hip. And actually, to caveat this, sometimes those two things can coexist as well. So we've got a really quite painful hip. Now, these symptoms are worse when the hip is put in certain positions. So if you're trying to get your shoes and socks on, the stretching type movement can be painful. Even the balancing type movement on the other leg when you're trying to put your shoes on the good leg might be painful. And things like laying on the side. So tendons, when they're really irritable around here, struggle when they're on a stretch. So you might have pain on the left hand side and you're saying, I'm laying on that side in bed and it hurts, but I'm laying on my good side and it also hurts the opposite side. Well, even when you're side lying on your good side, if your legs and your knees are together, it's still adding a bit of a stretch here, and that normally is absolutely fine. But in that case of a hip that has tendinitis around here, it might be that it just can't tolerate even that degree of stretch. And that's why it's really important in these scenarios to seek help from a professional who really understands how to manage this. And actually, going forward in other videos, we're going to be publishing videos. I say we, like I have a large team. I don't, it's just me. I will be publishing videos in regards to some of the basic tips and tricks and management tools from an exercise perspective to manage lateral hip pain. So subscribe to this if you haven't done yet, and obviously you'll get notified. But other signs and symptoms to just be slightly aware of are when patients are, or when individuals are doing things like, getting in and out of a car or putting the hip in certain movements, similar to what I said about the twisting of the leg. It may be a little bit provocative. And as a result of all these signs and symptoms gradually getting worse and worse over a period of time, well, what happens if a year or a year and a half goes by, you get to a point where things are painful even when walking, when even using stairs, and actually the painful picture really starts to increase quite considerably. Now, from a management perspective, this is what we want to kind of really briefly touch on here in regards to not necessarily specific treatments, but just the route that we want to take, what might probably be the better option for these patients. Now, on one hand, the thing that is absolutely fundamentally top of the list, exercise. Lifestyle changes, giving guidance in regards to how to be active, and hopefully reducing some of those risk factors are key. But exercise is absolutely should be top of the list, because if you're thinking about what I said at the beginning, we have a tendon issue, or maybe you could refer to it as a deconditioned, weaker, intolerant tendon, which is why it's so painful when you're doing activities like walking and stairs and kneeling and crouching and all those things. So the exercise approach and those principles will help increase the tolerance of these things and hopefully make someone feel a little bit more physically robust. There are other options to consider. That some are great, some aren't so great, but equally some patients with this level of irritability sometimes struggle to even do those exercises and can go down the route of things like injections and other types of treatments that we'll discuss in further videos. But the fundamental first protocol for someone who has greater trochanteric pain syndrome or gluteal tendinopathy, remember it's not just the bursitis, so we won't refer to it as that now, has to be heavily focused on exercises. Now, just to finish this video, there's one really important point that I need to get you guys to consider. This condition isn't going to be resolved in 2 weeks, in 3 weeks. It will take a long period of time. The natural history and progression of this condition can take months, if not up to a year plus. So if you're not seeing immediate quick changes, don't be despondent. If you're not seeing some sort of miraculous functional improvement after just doing it for a month or a few weeks, don't worry. It can take a bit of time. But what you do have to consider is making sure that you're doing all the right stuff, making sure that you're trying to limit the things that might provoke it, that might not be the best suited placed exercises or treatment approaches for something like this. Get support from a specialist or an MSK type provider, and just give it time. Give it time. Make sure that you're just optimizing everything as much as possible, but consider the fact that it will take a while for it to settle down. If things aren't improving and you've got a clinician that's helping you out and you're doing all of those things and you're still not getting any better, at that point you'd probably want to take a step back as a clinician, like I would, and just say, have we definitely got the right diagnosis? What else might be playing a role? What else might be coexisting? And let's try and figure out why things haven't been improving. If you've enjoyed this video, if you've suffered from this, if you found this useful, if you absolutely hate this video, either way, leave a comment. A comment is better than no comment, but I hope you found it useful. We've got loads more videos to come, so please subscribe. It's a new channel, so I'd really welcome the support and hope to see you about.